A rare disease is officially defined as any condition which affects fewer than 200,000 people in the United States, and there are as many as 7,000 such diseases affecting a total of 30 million Americans. Such conditions often go undiagnosed or misdiagnosed for many years, and the symptoms can have a variety of debilitating and life-altering effects on those afflicted. With so few patients to study, and very little research being conducted on these disorders, in many cases no treatments or cures are available. Many such diseases have strange and unusual symptoms and are widely unknown to the general public. However, millions will often suffer in silence and behind closed doors. Here are 5 of the most unusual and rare diseases and disorders on Earth. Number 5. Walking Corpse Syndrome. Porphyria is the name given to a group of diseases which is caused by a rare abnormality whereby heme, which is the part of hemoglobin containing iron, which gives blood its red colour, fails to be produced correctly. Each type of disease is caused by a different version of this abnormality, and the resulting symptoms are therefore numerous and varied, but nevertheless disturbing and unpleasant. The disease is thought to affect 1 in 50,000 people, although exact figures are hard to come by as many cases remain unreported. And while there is no cure for porphyria, treatments do exist which can shorten the duration of an attack, as well as reduce its intensity. Acute versions of the disease can cause attacks, which consist of severe abdominal pain, vomiting, a rapid heartbeat, and mental disturbances. The more severe cases of these attacks can also be accompanied by muscle weakness, paralysis of the limbs, and even seizures and comas, and patients may also demonstrate psychiatric symptoms such as hallucinations and occasionally even psychotic behavior. Other versions of the disease cause severe skin problems amongst those afflicted, making the patient extremely sensitive to light, which can cause intense pain, burning, and blistering of skin exposed to sunlight. The most severe example of the disease is called HEP, where the patient may suffer extreme shortening of their fingers, the loss of hair and nails, and the gradual disappearance of the ears, lips, and nose. There have also been instances whereby the gums become so taut that the teeth appear to jut out in an animalistic manner. Such unusual changes to the person's outward appearance, coupled with possible violent psychosis and sensitivity to light, has led some to connect the disease with vampire legends, pointing to the possibility that many people who were thought to have been vampires in the past may have actually been sick with porphyria. Sufferers would have likely avoided venturing out during the day so as to avoid the painful effects of the sun. Their teeth may have appeared as fangs to onlookers, and as the ears, nose, and lips would have been missing, or in the process of falling off, the sufferer would have likely avoided looking at themselves in the mirror, as it would have no doubt been distressing to witness the terrible effects of the disease on your own face. Even the drinking of blood is somewhat linked with the disease, as patients will often have purple-coloured urine, which may have made others suspicious as to what they were drinking. Porphyria patients have also been reported to have an aversion to garlic, as the chemicals it contains may aggravate symptoms, and the aggression associated with certain cases of the disease may have made sufferers violent and irritable, and therefore caused them to be seen as highly dangerous by those around them. Number 4. Stoneman's disease. This rare genetic disorder occurs in just 1 in every 4 million live births. However, for those affected, a diagnosis is life-shattering. The sufferer will experience symptoms similar to accelerated aging, and the average life expectancy is just 14 years, with very few patients making it into their 20s. A diagnosis is usually made in the first few months of an infant's life, with the patient experiencing limited growth and rapid hair loss. Those affected usually have a very distinctive appearance and will tend to have a small face and recessed jaw, with young children looking several decades older than their true age. As the child ages, symptoms will become more severe and more visible, as well as the development of severe health problems such as kidney failure and heart conditions. The body rapidly degenerates, with levels of body fat and muscle dropping over time, and health issues normally associated with the elderly, such as stiff joints and hip dislocations, quickly become apparent. Death is commonly caused as the result of a heart attack or stroke, and some patients pass away as early as 10 years old. Although mental development seems to be unaffected, the child is unable to live anything close to an ordinary life, unable to partake in common activities such as sports that other children take for granted. The disease is caused by a gene mutation that takes place in the early stages of embryo development, and it's rarely hereditary, as carriers are unlikely to live long enough to reproduce. This mutation is thought to affect a gene that encodes the protein which holds the nucleus of the cell together, making the nucleus unstable and thus causing rapid aging. Although there is currently no cure for this devastating disorder, several promising treatments are being worked on, and there remains hope that the disorder will become treatable in the not-so-distant future. Scientists are also optimistic that such research might reveal clues about the aging process, which could lead to the development of other treatments for aging-related illnesses and diseases. Number 3. Alice in Wonderland Syndrome. This rare affliction is a brain condition which affects the sufferer's visual perception of their surroundings, as well as of their own body. Humans, animals, and other objects may appear to be far smaller or larger than they really are, resulting in the unnerving sight of everyday items appearing to suddenly grow to giant proportions or shrink to bizarrely small sizes. A dog may suddenly appear to expand to become a towering monster, or a car may shrink to the size of a toy. Objects may also appear much closer or further away than they really are, which can be extremely disorientating as corridors appear to stretch on endlessly, or the ground beneath your feet seems to be just inches from your eyes. The person affected may also see their own body change in size, becoming much larger or smaller than their true self, or otherwise seeing individual parts of their body drastically changing in proportion. Another common trait is the loss of the sense of time. Seconds may seem to last for minutes, turning a casual stroll into what seems like an Olympic sprint as the world rushes past you. It's no surprise that sufferers of this unusual syndrome often become afraid and panic-stricken by such symptoms. However, the syndrome itself is not thought to be physically harmful. Possible triggers are the onset of migraines, as well as stress, infections, and a lack of sleep, and brain scans of those affected do not show anything out of the ordinary. It's generally thought to be caused by a change in the part of the brain that processes perception, and as most symptoms tend to occur at night, it's been theorized that the disorder could be triggered by changes in sensory input, such as the changes in noise and light levels at night when compared to daytime. The syndrome seems to be most common in young children, and in the majority of cases, symptoms will disappear on their own when adulthood is reached, although they do occasionally return in later life, especially as a result of stress, yet at this time no treatment or cure currently exists. Number 2. Progeria. Also known as FOP, Stone Man's disease is a type of genetic disorder that affects around 1 in every 2 million people. The condition is caused by a gene mutation which affects the body's repair processes and causes muscle and other tissue to essentially turn into bone, either in response to damage inflicted on the body or just spontaneously. Minor injuries can cause the body to become permanently locked into place, and slowly over the lifetime of the sufferer, a second skeleton will form inside the body, leaving the person permanently immobile and eventually killing them. Extra bones inside the ribcage will affect the patient's ability to breathe, and often the mouth will become locked shut, making eating and speaking difficult. Most patients are wheelchair-bound by the time they reach their 20s, and very few will survive past the age of 40. Simple everyday tasks are difficult or impossible, and any accidents or damage to the body will result in the body attempting to repair the damage by creating more bone, inflicting huge amounts of pain. In fact, even viral infections or just stretching a muscle too hard can result in additional bone formation. The disease is so rare that patients are often misdiagnosed as suffering with cancer or fibrosis, which can result in disastrous surgery and biopsies, which only make matters worse as the body tries to heal itself by creating even more bone. The disorder is caused by a mutation in the gene ACVR1, usually as the result of a mutation, but sometimes passed on from parents. Cells will rush to a damaged area of the body, but instead of just healing and repairing the damaged area, they destroy it. New cells then move in, replacing an area that was once muscle tissue with new bone. The terrible result for the patients are joints and ankles, which become frozen in place as the body eventually becomes as rigid as a statue. Different patients will become frozen in different positions, some left locked in a horizontal position, others twisted at the torso, and others bent backwards. The first detailed report of the disease was in 1736, however for years afterwards little progress was made in understanding or treating it. Even today there is no cure or approved treatment for FOP other than avoiding activities which might increase the likelihood of injuries or stress to the body. In this way the development of new bone might be slowed down and pain can be managed with treatment. However, because the disease is so rare, making progress is proving difficult, as there are so few patients to take part in clinical trials and medical studies. Number 1. Porphyria. Also known as Cotard's delusion, this extremely rare mental illness leaves the sufferer believing that they are either dead, do not exist, or that they have lost blood, internal organs, and even entire parts of their body. This delusional belief will often result in the afflicted person withdrawing from normal life, neglecting day-to-day things such as personal hygiene and health, and being left unable to work or interact with others. Their view of the world becomes completely distorted, and even though they are still breathing and otherwise physically healthy, the sufferer will remain convinced that their body is dead and that they are somehow trapped within their walking corpse. It's common for sufferers to spend much of their time at cemeteries, as it's only in such places that they feel amongst their own kind, and the disorder can often result in severe damage to physical health, as the patient will not only neglect to care for their body, but often stop eating altogether. Paradoxically, they often feel invulnerable. After all, if you're already dead, then surely nothing can kill you. Sufferers also commonly report being able to smell their own flesh decaying and experiencing the false but disturbing sensation of worms crawling through their skin. Cotard's delusion is believed to be one of the rarest diseases on Earth, and no more than a few hundred people are estimated to be suffering with it at any one time, yet more about it is slowly being uncovered. It's thought to be caused by neural misfiring in the areas of the brain responsible for recognizing faces and associating emotions with human faces. This thought leads to the sufferer believing that the face of someone they know is in fact the face of an imposter, and when they see their own face in the mirror, they are simply unable to associate it with their own identity, leading to a belief that they do not actually exist. The end result is often complete detachment with their own body, leaving them with the belief that their body is dead or that parts of their body are missing. French neurologist Jules Cotard first described the disorder in 1880 while treating a patient who claimed to be missing multiple body parts and internal organs. The woman believed that as she lacked so much of her vital organs, she no longer needed to eat and refused all meals, resulting in her quickly dying from starvation. Since then, the disorder has been linked with people who already suffer from psychosis and other mental illnesses, and fortunately medications such as antipsychotics, combined with therapy, seem to have had some success in combating the illness and giving those afflicted a chance at living something of a normal life.